The default starting screen after logging in to FirstNet is Edie launch point. Ignore this. Open the Edie tracking list by clicking on the toolbar. Using the tracking screen. The tracking screen shows the list of patients in the department, their demographics, bed number, presenting complaint, most recent set of vital signs, and the status of various ED processes. The first time you access the ED tracking list, it will show all the patients in the department, including any pre-arrivals. You should narrow it down to your assigned working area, either acute, fast track, or short stay. The order of the default tracking screen has patients not yet assigned to a treating clinician, TC, at the top of the list, ordered by triage category, T, and within each category by length of stay. Patients who have been assigned a treating clinician appear lower in the list, sorted alphabetically according to treating clinician. The column TC displays the treating clinician. If a patient has a blank space in the TC column, they are not yet assigned to a doctor. If your name appears there, you are the treating doctor responsible for that patient. Make sure you keep track of your patients, especially before going home after your shift, when you should hand over to another doctor as appropriate. The SMO indicates that a senior doctor has assessed the patient. If the TC column is still blank, this patient is still unassigned and requires a treating clinician. Important icons on the tracking screen. Open patient chart, add order, documentation, interactive view, and managing deterioration. Patient summary report, Discharge process. Checking in. The first thing to do at the beginning of your shift is to check in to FirstNet. This must be done so you can assign yourself and be assigned by the consultant to patients. Do this on the ED tracking list by clicking on the green tick icon. This box will open. Complete required fields: display name, provider role, default relation, assign teams. Then click OK. Assigning yourself to patient. Make sure the tracking screen is set to your area, acute or fast track. On the default screen, the filter should match the name on the tracking screen tab. If not, select this yourself. This results in a list of patients with those not yet assigned to a treating clinician at the top of the list, displayed in order of triage category and length of stay. The next patient to be picked up or assigned to a treating clinician is thus at the top of the list. The team column is color coded for either acute, blue, fast track, green, peds, pink, and streaming, yellow, or ACT, mental health, in black. Make sure that the patient you are considering assigning yourself to is the team appropriate for your shift. When you've decided who is the next patient to be seen, double click in the TC column for that patient. The Assign Unassigned Providers box will open. Find and select your name in the treating clinician drop-down list. Opening the patient chart. First, ensure you have the right patient highlighted on the tracking screen. There are 3 ways to confirm this: in patient box on the tracking screen, highlighted in grey, and name in the top right banner. There are a number of ways to open the patient chart. Double clicking on the blue triangle at the far left of the tracking screen, clicking on the patient chart icon, right clicking on the patient name, and clicking on the drop down menu next to the patient's name on the top right of the screen. The patient chart can be navigated on the left-hand side of the screen and give you access to vital signs in managing deterioration, orders, allergies, alerts, documentation, previous ECGs, nursing documentation and discharge summaries. Making orders. There are multiple ways to access the ordering screen. From tracking screen, click the orders icon in the toolbar, or in the patient chart next to orders, select add. The order window looks like this. To order tests from a personal plan, click the favorites icon, which is the yellow star, open the personal folders and then select the appropriate plan, e.g. chest pain. Then click done. The following screen will appear with all the tests in the personal plan. Click orders for signature on the bottom right and then in the next window click sign and enter your password to sign the order. If you are ordering tests outside of the personal plan, use the free text search option. For example, to order a full blood count, search FBC and select. Select all the orders you require, then click done. Fill in the required details on the request form. Clinician collect, yes. Collected, no. Collection priority, urgent. Reason for order details. Collected for date, type T for today, and for time, N for now. And then sign your request. Use orders to record referrals. Click Favorites, open the ED Consults folder and then select the appropriate consult. Click Done. In the next window, complete the mandatory field in yellow at the bottom of the form, confirming the inpatient team. Then click Sign on the bottom right and enter your password. Documenting your patient encounter. To document your notes, click on the documentation icon on the ED tracking screen. You can then choose the type of document you want to create. Type, select Progress Notes Emergency. Title, Team Role Reason, e.g. ED Intern Assessment. Select the ED note template. Consider using the consultant ward round template in ShortScope. Complete your documentation filling in all the relevant fields in the template. Sign and submit your notes as you go. Addendums can be added at any time by double-clicking on the document you created. How to add a diagnosis. Double-click on the diagnosis field for your patient. Click Add. Enter text and search for the correct diagnosis. Click on the binoculars. Type should be working. Discharge process. If you are discharging your patient from the ED, you must complete this yourself. Select your patient on the tracking screen, then click the Depart Process icon. Make sure there's a working diagnosis. Complete the mandatory fields for ED departure. Adding an actual departure date and time will discharge the patient from the tracking screen. Currently, there is an additional field to complete on the discharge regarding impact of alcohol. Click on the green arrow to save and close the impact of alcohol screen once completed. In the letter, insert GP name if known. Click on comment to enter the text for discharge letter. And click on clinician signature and enter your name and provider number. handover. To allocate a new clinician for a patient, double-click on the TC column next to the patient. Click Assign More button and add the clinician taking handover. The rat Molly. To record your rat, double-click on the SMO column next to the patient and select your name from the drop-down list. This will stop the clock for the time to be seen by a clinician, so make sure the time is accurate. If you also take on the patient as the treating clinician, double-click in the TC column and select SMO in the drop-down list. Pre-arrivals patient expects. To record a patient expect, select the TTH pre-arrival tab on the tracking screen, then click on the ambulance icon. The following window will appear. Complete the fields highlighted below and then click the OK button. Your new entry will appear in the TTH pre-arrival tab on the ED tracking screen.